Lymphoma is the most commonly diagnosed neoplasia in dogs today. Canine lymphoma is characterized by unregulated lymphatic cell growth, usually originating in the lymphoid tissue and often becoming metastatic. The disease varies in its pathogenicity, symptoms, and origin, with diagnosis usually being achieved through cytological or histopathological evaluation of the affected tissues or blood. Doxorubicin is an anti-cancer agent used to treat this disease, usually in combination therapy known as CHOP. The specific mechanism of its action is a topic of contention. However, studies suggest that the drug works through complex pathways to inhibit cell proliferation and also has cytotoxic effects on the fast-replicating lymphoma cells. Here is an overview of how the drug works to stop the neoplastic lymphatic cells from proliferating, reducing its ability for further spread. Intercalation into the DNA strands stabilizes them while unwound. Inhibition of topoisomerase II prevents the recoiling of the strands. This action, though, has been identified as a cause of the doxorubicin-induced cardiotoxicity through its effects on topoisomerase II beta found in the cardiomyocytes. Production of reactive oxygen species damages the exposed DNA, and DNA synthesis inhibition is achieved through a complex pathway that aids the control of the cell growth pathway via the regulatory P21 protein. While the mechanism of its action remains somewhat unclear and is the topic of ongoing research, the efficacy of doxorubicin can be considered through studies conducted using dogs diagnosed with lymphoma. Although relapse is common, the consensus is that the remission rates are good. Thus, doxorubicin is considered a standard of care protocol in veterinary medicine for dogs with B-cell lymphoma. Let's take a look at the evidence. A study in 2013 investigated the response of 31 dogs with multicentric lymphoma to CHOP chemotherapy. The results showed a response rate of 100%. The median disease progression-free period was 140 days. This study looked at a dose-dependent response and showed that administration frequency and quantity is important to achieve remission. An earlier study published in the Journal of American Veterinary Medicine Association showed that of the 29 dogs with a B-cell lymphoma treated with doxorubicin, 25 had a complete response. A patient showing a complete response means they've achieved remission and are considered disease-free for a period of time following the treatment. As a cheaper alternative, some clients do consider single-dose doxorubicin, which has proved its efficacy in prolonging the lives of diagnosed B-cell lymphoma patients. This retrospective case series, conducted over 2 years from 2006, provides the evidence for this, since the study recorded responses from dogs who received doxorubicin alone and no other treatment included. Now, it's important to note here that this same study also described T-cell lymphomas as non-responsive to the drug. So doxorubicin may be considered an effective method for achieving remission following the diagnosis of stage 3 or 4 B-cell lymphomas, but alternative protocols should be considered for the less common T-cell lymphomas. While it is clear that the efficacy of doxorubicin is increased when administered in conjunction with other anti-cancer medication, its exclusive ability to inhibit the replication of tumour cells can't be overlooked. Administration of doxorubicin may be considered a cost-effective method of achieving remission and prolonging the lives of dogs diagnosed with B-cell lymphomas. According to the literature, I believe that the administration of doxorubicin for dogs diagnosed with B-cell lymphomas is an effective way to treat this disease.